Hello, my name is Dr. Tejal Gandhi, President of the National Patient Safety Foundation, or NPSF. We want to be the global leader in patient safety by bringing together patients, providers, industry leaders, and policymakers to drive improvements in patient safety. Our key goal is to create and disseminate new knowledge about patient safety broadly. We do this by having the Lucian Leape Institute at the NPSF, which is a think tank named for the renowned patient safety leader, Dr. Lucian Leape. At the think tank, we convene national experts in patient safety from around the country and the world to talk about key safety issues that we want to change or advance. For example, we would convene roundtables on topics such as patient engagement. How do we better engage patients in their care? How do we train physicians to deliver care more safely? How do we ensure that the workforce is safe? Without that, we cannot have patient safety. The Institute then releases reports on these key safety topics, and those reports are disseminated widely and have influence both at the local level on local leadership, also on a national level for policymakers, and then hopefully impact on the global level as well. What are we talking about when we're talking about patient safety? We're talking about medical errors that harm patients. An example that I became aware of was a mother whose child was receiving chemotherapy, and the chemotherapy was being administered, and the mother asked the nurse, "This chemo doesn't look quite right. Are you sure it's correct?" And the nurse checked the bag and said, "The bag says it's the right thing, so it's fine." The mother again said, "Are you sure? It really just doesn't look right." And the nurse again checked the bag, and it said the right thing, and she said, "Yes, it's right." And the child actually did receive the wrong chemotherapy and ended up dying from that medical error. And so what we really try to do in patient safety is think about, well, what is that process for how that medication was created, and how do we change the system and the process so it doesn't happen again, as opposed to just saying, well, fire that pharmacist or fire that nurse, which never will solve the problem. The work of NPSF is really critical. One day, you, me, or someone we know will be patients, and we want to make sure that they are not harmed by healthcare. And so the work of NPSF is really working to make sure we deliver the best, safest care without harm. Thank you for taking the time to learn about NPSF, and we would really appreciate your support for this very critical mission.